Awesome to see people coming on in.
Hello, welcome. Glad to have everyone joining us today. We'll kick it off. Welcome to everybody, and thank you for joining us. My name's Adele. I'm very happy to welcome everyone to our discussion for today. As we're seeing out there, AI is everywhere right now. It's promising faster insights, smarter workflows, new ways of working. But in behavioral health, the conversation it's understandably a little more complex. We're not just talking about efficiency or innovation. We're talking about trust, privacy, security, the care of real people. That's why today's webinar is really to have a thoughtful and honest conversation with our agenda being designed of half of us presenting to you and half of it as an open discussion. So we can explore some of these ideas together. We want to hear your perspectives. We want to learn from your feedback and real world experiences. Today, it's really about exploring what's possible, but also what's responsible, what makes sense, specifically for EMHware and the organizations that you serve. AI, it's not just theoretical anymore. When it's implemented carefully, it has the potential to really support frontline workers, to reduce that admin burden, and ultimately improve care. But it has to be done intentionally and securely. And that's the lens in which EMHware is bringing to this conversation. We want you to leave today with a much clearer understanding of how we're thinking about AI, where it could fit into the EMHware roadmap, and just as importantly, how your input can help us shape what's coming next. Our role is really to be a partner here as we explore this responsibly. Today, you're going to hear from Sam, the head of behavioral health at EMHware. He brings a deep experience in behavioral health technology, EHR modernization, and AI strategy that's bringing that data-driven solutions that enhance both counselor and client experience. And you're also going to hear from Mark. He's the head of engineering and technology, and he's going to share how we think about security, scalability, and responsible implementation behind the scenes. This is definitely meant to be a conversation, so please ask your questions through the chat, share any of your concerns. We want to see what the AI could look like within EMHware together. But before we dive in, we want to hear from you. Take a moment to answer a quick poll. It's going to ask a little bit about your comfort levels with AI tools and any concerns that you may have. So take a moment. Your input's going to definitely help shape our conversation, so don't hold back. We definitely want to hear from you. And thank you. I'm going to hand it over now to Sam.
Awesome. It is so fantastic that everybody could find time. We are just cracking 100 people on the call right now to talk about AI and how EMHware is thinking about it and how we're going to put it into practice and the controls that everyone will still maintain as we start to go down this route with everybody. Um, as Adele mentioned, AI, you hear about it every single day on every single piece of media that we have on social media, and then also just in workplace chatter. And you end up with it's going to change everything to there's going to be the world's going to end. And I think where a lot of things end, it ends up being in the middle, but us being in healthcare and community health and behavioral health specifically, we have a very important role to play in how people are impacted by AI. And when we start to think about some of the applications that came out early in kind of the AI renaissance that's happening, you have opportunities for application in things like medical imaging, can see spots of cancer faster, supporting X-rays, MRI analysis starting to look at some of the operational components where maybe it's going to improve your scheduling, have dynamic scheduling to make sure that you don't have the same gaps and it can support on some waitlist management. And then things like AI scribe, where you're like, might be a little creeped out that something's listening to me all the time, but also how much better is this that I can sit here and fully be present in the conversation without having to worry, am I getting the proper notes? And with all of these solutions, you also hear AI slop, where you're just overwhelmed by the amount of content, and people are just like, "Yep, should be good enough. Copy and paste it in," without having that critical thinking and realizing that our roles in all of our roles, whether it's client facing, whether it is in software, whether it's in any function of an organization, our roles are starting to shift to be editors, to be prompters, to make sure that we are critically analyzing every piece of data that's coming out so that it is still correct to the best of our knowledge. So today, when we think about AI, we start to think about what matters most. And a lot of it comes around a responsible adoption of AI. And that sounds like fluff. But we started looking, and as we've been chatting with a lot of partners, a lot of clients, different people applying AI within healthcare, outside of healthcare, um, we realized there's a lot of really unique things that we always need to have at the forefront. And we've always had it as EMHware at the forefront of our product, which is data privacy and client safety. That is one of the most challenging things for new vendors to be able to understand. And as people are bringing new products, is how granular you have to be on the privacy and safety front and be able to understand why that's important in the context of behavioral health. We need to work collaboratively with our assumptions we come into the product development cycle with and challenging those with the real day-to-day feedback that we get from clients, from your staff, and from your clients. So it's really important for us to make sure that we're challenging any assumptions we have and really ensuring that we're capturing every use case we can and where we should be looking where there might be something that happens or a very specific program that might be slightly different than everyone else and everything else that we need to factor into our products. And then making sure that we bring in experts at the right time. So there are times where we need to have technical experts, there's going to be times where we need to have clinical experts, and there's going to be times where we need to have operational experts. And making sure that the right stakeholders are coming to the table so that we can partner in navigating the advancing of innovation within all of our organizations. So is it the right time? I think this is the question a lot of folks have. Um, are we going too fast or too slow? Should I be putting AI in everything? Should I be putting it in nothing? Is it going to be safe? Is there risk for me in my role? Is there risk for my clients? And I think you kind of end up with there's the people that are like AI is definitely kind of the easy, it's going to make life way better. And we should put it everywhere. And I'm going to have so much time. And then you have the folks where it's going to be like, oh my gosh, it is going, we're not ready to handle this, or this is so unsafe and it's not tested enough for us to know the actual implications. And I think the interesting and the complex part is both can be true. You can be very excited about how much easier it's going to make, and also be a little worried, and rightly so, that it hasn't been proven out that it is going to be as impactful and it is going to be as safe, and you actually understand where the data is going and how it's being processed and transited, and all of those pieces of the puzzle that go into what is AI and how does it work. So as we start to think about AI as being part of our toolbox, I don't think in the near future, in the next 2, 3 years, that AI is going to take over everything, especially as we look into community services, into community health and behavioral health specifically. It is far too nuanced to be impacted that fast. I do think a lot of workflows will be enhanced. I do think it'll be a strong partner. So as we start to think about keeping the protecting of client data at the forefront, it's really important that we start to know that technology is a tool as it has been. So what I mean by that is we moved everything to the cloud. Most people are operating in the cloud rather than on a server in their workplace. That was a big change. You now no longer controlled your data in the same way. We're doing a change like that now, and we're starting to see that where now you have other things starting to work with your data and enrich it and being able to add additional data points to some of the base data you have that hopefully can help with decision making, but will not replace decision making. We still need to have that expertise that especially the clinicians have on being able to make those determinations on what are the best paths, knowing that the information set will not be fulsome and fully tailored to that individual client. And I think where there's some really great opportunities is funding isn't increasing. Funding hasn't increased. This is an opportunity for how can we make people more efficient so we can give the best care we can give with the money that we have, and hopefully reduce the amount of load on the actual people delivering services because burnout is a real thing. I think every organization is seeing a ton of turnover. It's hard to get people to come into the sector, and it's really important that we find ways to reduce and streamline their workflows so that they can be present while they're delivering care and they have the tools that will make them most effective at doing what they do and helping their communities. And for EMHware, our priority is still making software and tools that are going to protect client data and also make sure that we're supporting folks in delivering better health outcomes. So as we look on how we can leverage the tools, there is lots of ways that are non-clinical to be able to apply tools within platforms. And so I'd mentioned some of the waitlist management, the scheduling, starting to pull some of those insights or summaries, summarizing your previous data that you've put in there, um, looking for ways where we're leveraging the work that's already been completed by your teams to make that review process faster and also be able to support in how do we make some of the reporting faster. So this, when we're looking at AI within EMH, where it is not purely about how do we have just reduce some of the clinical inpatient stuff, there's going to be lots of components of AI that will never interact or be part of a patient or a client visit. And that's important to keep in mind. There's a lot of operational things that people do or workload that is not a direct contact um, that we can focus on how do we make people more efficient and make their roles easier so they can do what they really enjoy doing. And this is where we spend a lot of our time right now is evaluating AI and evaluating different vendors and opportunities where someone might have something that is so great, we're not going to be able to do it better. And this is where a lot of our conversations have been happening with our clients. So you as organizations around here's some of the things you want to look at to make sure that they understand the boxes that they need to have checked as a software provider to be able to run effectively and ethically within the behavioral health space. And we find it is very easy for someone to make a new platform that is AI enabled, that might do some scribe or some dictation and formatting, but they miss a lot of the nuances that will pop up post implementation where you're like, oh, I can't do granular privacy on that one record. They're going to see everything or nothing, or they're going to see some of the stuff they really shouldn't see, or they see everything. And that's really important to start to know what are those questions to ask. And what are how do other people evaluate some of these tools that are out in the market so that you're going in eyes wide open and that you know that the care is at the center of the decision that's being made. So on the screen, you'll see there are a number of either legislative or government entities that do support in saying, here are some people we've vetted. The list is never going to be fulsome, but it will give you some insight into what are some of the things that you should be on the lookout as you're looking at what is out there to be able to support your teams. And then as I finish up my final slide before I hand it over to Mark, which is going to be probably the most interesting part for folks on the call, and we'll include some of our roadmap as how we see it now. Here are some of the other things that we look at. For us, it's really important that the data is not training the model, especially if it's live client data. It's really important for us that the data is transiting in Canada, being stored in Canada, and is also the models are in Canada. And so that becomes tricky because there's a lot of stuff behind the scenes that we're putting that data has to go into, and you want to make sure each part is going to align with most organizations' best practices, even if that is more stringent than what some of the legislative components are around data. And the Canada piece is the number one where it's Not in all provinces is it mandated that your data has to be in Canada at all times. Most organizations abide by that. And that is something that EMHware abides by as we look at our various partners. If it is related to client data, it's going to be staying in Canada. Another big question is around data retention. And how do they ask for data? And then are there ways that either the main system of record or the other solutions that you're using, the more niche solutions, how are you starting to capture consent? How do you make sure that you are prompted and your team is prompted to be very transparent that I am using a note-taking tool to help me be more present as we're talking. I will review those notes and the data is automatically deleted from the note-taking tool at the end. Those are great questions to be able to ask on, okay, is this a tool that is going to delete that data? Are my clients okay with that? And is there an ability for them to opt out of that and not have their data used in that way? Because ultimately they need to be in control of their data. I'm going to hand it over to Mark now. Mark's going to run through some of our approaches on the building of the software and then walk through some of our product vision as well. So over to you, Mark.
Thanks, Sam. So, great. As a continuation to what Sam was saying, we want to demystify and provide a lot of transparency in our approaches to how we want to implement AI, especially with the trust in the data that we have. So, our approach is really the above workflow that you're looking at here is really how we intend to approach it. It's going to be a tool for us to input system inputs from take the data from the existing image and provide it to the systems and providing it the responses that can really be consumed by the customers. Our role is actually to ensure that our approach to AI is, you'll hear me say this a lot, is be accurate and private. So we're really going to be using our existing platform to augment it with the existing rules that we have to make sure that the data is secure and provided to the proper users. And when we talk about training with AI, we want to collaborate with our partners to ensure that, again, safety and security are top of mind for us as we process a lot of the features that we intend to deliver in the roadmap. And we want to be responsible about the data and how we're actually using it. And really, one thing about AI is that based on the different types of models that we use and the responses, they can differ. This is where the different use cases come into play, and we want to use our expertise to filter out the appropriate responses as we implement our features. So EMH's approach is really about unlocking these following points to help our customers get the most out of the features we build. Really good example is using AI to improve customer experience and making their lives easier. Taking over the note-taking and the formatting. I'll talk a little bit about the scribe functionality in our roadmap later, but it's really kind of enabling the clinician to focus more on delivering the care. AI can help summarize these conversations that are being held, like really freeing up the time with the clinician to do more of the important work and really enable future form filling, which is applicable to reducing the input of data. As we all know, things like that can be quite time consuming. So as we look into implementing these features, we really do need to be responsible as well on the implementation. So we want to really consider in the factors around responsible AI deployment. A few things that I really want to call out is, AI can provide inaccurate results or responses. These are called hallucinations. AI doesn't distinguish between private or public data. This is, again, where EMH and our expertise comes in and all the years of building out our existing platform and securing it. Now, general purpose AI, ChatGPT, everybody knows about ChatGPT, really requires that we build a lot of these post-processing guardrails, again, to ensure the security and the privacy of the data that the AI is producing. And compromising of private health data is non-negotiable. I think that's really important to call out. Even in our existing platform, pre-AI, this has always been the top of mind. And because training AI is sensitive, it's something that we do want to ensure that we're collaborating with our customers on to ensure that we're using it responsibly, and we don't want to reveal too much. So why does security matter to us? I mean, AI is a really powerful tool. We want to always ensure that we're always aware that, like any humans, AI does have the same kind of pitfalls. AI can be tricked into divulging sensitive information, passwords, PHI. I think everybody has kind of seen these throughout as AI has been developing out there in the news. Hallucinations can mislead and provide wrong information. We want to be really mindful that these incidents don't occur, especially when it relates to care to our patients. And privacy and accuracy, you'll hear me say this a lot, is really an important part of our existing platform pre-AI, and our intention is to make sure that it's also top of mind post-AI. So as a company, we want to be leveraging our existing business expertise and rules, our platform functionality, and extend it to our upcoming AI initiatives. Our goal is really to leverage our experience in privacy and making it complementary with how we implement a lot of these features. And we're always thinking about the security and privacy, and we need to ensure that we do that in a scalable manner. So really, I just covering the security at the core. We have lots of experience around working with our existing customers and the guardrails. We intend to augment that with the delivery of the feature set that we have. Um, and the platform that we built has always been based on privacy, and we intend to kind of move that forward as well. And the last thing around, we're part of a larger group with EverCommerce. So we also have the luxury of leveraging their security and privacy expertise as we pursue a lot of these feature development going forward. So three key important pillars as we pursue our AI roadmap. Very top of mind is the privacy. Can't stress this enough. We hold a lot of patient data. It's not something that we can compromise. We've done it in the past. We intend to move forward with the same level of security and privacy in mind. And as Sam alluded to, scalability. We want to ensure that we're making the most efficient use of the resources of all our customers so that when we build these out, it's something that we can help leverage across all the orgs and in the most cost-efficient manner, but also deliver the best experience for all our customers as well. And finally, accuracy. When we start building out these particular subset of our AI capability, we want to make sure that the responses that are provided are as accurate as are accurate and not subject to the hallucinations, which where our post-processing filters is something that we're going to factor in. So for a roadmap, I just want to cover a few things around these areas and domains and just talk a little bit about them. So for this year, the case note summarizer is something that we're going to be looking into where to save time for our clinicians is to take a subset or a group of case notes and use AI to effectively summarize it, avoiding the need to actually read all of the case notes. So really in terms of time saving, it's something that should be quite beneficial. The in-app assistant, which is our feature functionality where we intend to ease the onboarding. So lots of new users get on EMH. There's always a new person that's trying to understand how to use the platform. We intend to leverage AI to feed all that processes and documentation in to actually help onboard much quicker, which will in turn help you onboard your users a lot faster. And finally, the scribe that Sam has mentioned. This is to help reduce the input and having kind of that ambient scribe in the background and just having the clinician focus more on giving the care rather than doing the manual inputs. So overall, high level plan, and Adele, I believe, will be launching a poll at this point, and I see it. So thank you. And just really to wrap it all up, AI really is a powerful and a practical and full of potential, but it has to be implemented responsibly. We need to make sure that security and privacy are always top of mind for us. So we're committed to doing it the right way. Uh, where we plan on doing these incrementally, so we're evaluating it. We're evaluating how we implement AI carefully to make sure that's secure and safe. And we want to make sure that during this time in our journeys through implementing a lot of these features that you're part of the process, you're part of the journey, and we're getting your feedback. And I pass it on to you, Sam.
Awesome. Thank you, Mark. Yeah, super. We're super excited about some of the roadmap items, especially. I do want to call out our quarters is we're in Q1 right now, rather most folks are in Q4. So Q2 starts in April. So a lot of this work, the the back end portions are happening. Um, as I wrap this up, I do want to call it there is the Q&A section. So we do have 7 questions in there right now. Please hop in there, ask questions. We will start going through that over the next chunk of time as we do the fireside chat in quotes. So Mark and I will come into the main part of the screen and we'll be able to answer them and people can ask follow-ups, all of that great stuff. So please pop lots of stuff in there. There's already some great questions in there. Um, we want people to share their thoughts. So there is going to be an email coming from Adele after that's going to have a few links. We're looking for beta testers. You can select which portion of that roadmap you want to help be a beta tester and have some feedback in. Help us make sure that we're thinking of everything because we have put a lot of thought into it, but we always know there's a few things on the fringes that we might not have thought of and a different approach that we could take, which is fantastic. Um, and also realize you can use the EMHware team as you have questions about some of these tools that you might be looking at outside of EMHware. And we're always happy to jump in and even chat with some of those organizations as we always look to see how can we partner with the broader ecosystem more effectively. Knowing that there's going to be some tools that is just the best tool for your organization, and we want to make sure that as kind of your main system, we're able to support you in your journeys as you make your organization the best it can possibly be for your teams and also your clients. So I am going to stop sharing. So Mark, we're about to go right into the middle of the screen. Perfect. Awesome. So I just need to move this over a little bit and we're going to start going through some of the questions. Mark, first one's for you. Can you explain the difference between MVP, beta, and generally available that were shown during the roadmap?
Sorry, I was on mute. That was bound to happen. Yeah, I mean, I can explain that. I mean, MVP for us really is MVP and Veda has a lot of similarities. But MVP really is more of a focus or smaller subset of the features that we intend to deliver as part of the overall features. For example, it'll also include a lot smaller audiences. So and maybe one thing I can talk about is the way we normally deliver a lot of these features is in an incremental fashion. So, if we would take the case note summary as an example, if we do implement that, we'll be releasing that to probably only like a couple of agencies, getting their feedback and making sure that it's working as appropriately. And then we would start kind of ramping it up to the beta group, which is a much larger group. And eventually, when that flushes out, then we intend to get it out into kind of a more generally available and part of our release.
Yeah, it's kind of the crawl, the walk, and then we're running to the group of it with it. is an analogy we like to use internally, and that might resonate. Uh, there are some really great questions around um, how do we like when we think about the clients that are coming into the organizations that are using EMHware, there are people from all walks of life. So they might be doing service in a different language. They might be doing service in English, but English is their second language. Um, how have you seen people looking at tools to make sure like things like equity, being able to understand people with accents, like how do you recommend looking at some of those solutions that we cover that as we do our builds?
Sorry, this question was for me, Sam.
Yeah.
Oh, sorry. Yeah, I mean, we know that we have a pretty diverse set of users across the board. And I actually noticed there was one question around the equity and diversity here, and I was just trying to answer it. But as we kind of evaluate a lot of these tools or models for AI and how we use them, language is always something that language and is something that will always factor in as we do the implementation. As everybody knows, there's a lot of different models out there, and some are better than others at doing these. So it's going to be one of our, I'm going to say, prerequisite checklists when we go through which model or which solution we use.
Awesome. Yeah, it's kind of one of the things where a lot of the tooling is improving so fast too that it is starting to be able to have that level of nuance and be able to detect some of the different patterns of speech. There are quite a few questions about this one, so I'm going to take this. Are you able to request that the AI functionality is turned off? When we look at the current roadmap, those are all opt-in functions. So, like most of our larger changes to the platform where it significantly impacts workflows, it is a turn on or turn off. Everybody gets defaulted to off. And if we are moving to part of it where it's like, okay, we're gradually making this part of the standard, then we would have a much larger communication around that, and we'd be working through those discussions with any organizations that have additional questions. So it will not be a forced on for everybody. At this time, and that it's not on the roadmap currently to have it be a forced on component of the platform. Um, around the just making sure we're hitting all of the themes
A
because
lot
there's
of
been
questions.
20 questions right now. It's fantastic. Case notes summarization. Can you walk us through what you mean by case note summarization?
Yeah, I apologize if I wasn't too clear about that, but really, after talking with a few of our agencies, one of the things that really came to light was the amount of time that it takes to review case notes. As everybody knows, it's a lot of text, and sometimes you have to go through a lot of them in one shot. And one of the things that we identified as a product to save time with our users is that why not get AI and feed those notes and have it summarize it for you and just kind of give you the key important points um, that is from those particular notes. So maybe it might take you, uh, 15, 20 minutes to read maybe 10, 15 notes, right? But if we realize that as a product that if we can somehow condense that and give you kind of like the key points in like a few minutes and get AI say read all of this and then generate me a key summary and then leave it up to you to divulge more into the details. That's something that we thought would be quite beneficial going forward.
Yeah, and then kind of as we've been talking about it, Mark and I talk about this stuff a lot, and we meet quite regularly on, oh, have you seen this? Like, how do we make this workflow better? How do we look at this tool? Just we keep hearing about this tool. Let's look at it. Um, I always think about the case note summarization, and this will be expanded more broadly to the rest of the client record, is how can we in the well, someone is prepping for their contact with a client that's coming in, How can we make sure that they can actually get all of the information about that client in a digestible format that they can read before the session? People are running around, they have a ton of things to do, they are back to back. And this is a way to allow people to be more prepared for each session when they're going in, to be able to look at some of the more historical information that they might not have had the chance to review, or if someone's coming back into service again, or they're in and out regularly, it allows people to be able to catch up faster. Mark, when we're looking at various AI tools, a lot of times it feels like it's just an additional layer. It doesn't feel like it's part of your workflow. Um, how can people think about AI within their workflows so that it complements the work that they're doing rather than either adds more things to click or is replacing that ability to have some of the judgment that we need? And this is a very loaded question, so I will probably have a follow-up to dive in more after.
Yeah, I mean, I think a good example is one of the items on our roadmap, just around Scribe. I think everybody has, to some degree, everybody has kind of seen that in action, but that really is probably a fairly pretty complementary in terms of like you launch the feature, it listens in the background, which really saves you from having to do all the inputs. So to me, that really just is a transparent, that just becomes a transparent part of your workflow. And at the end of it all, you have this summarized or captured note where you really didn't have to pay attention to. It was just there listening in the background. So I think that's one really good example of a really complementary use of the tool. And the summarizer is probably another good one where you're essentially think of it like an assistant telling you, hey, can you please read me um, a whole bunch of my notes from the last day or two, or even the last week, depending on how the feature is implemented. And it just helps provide you kind of like, here you are in bullet points, and here's the key things that you need to know. So I think it's a good way to look at it that way, where it's there, it's helping you in the background. It's like, think of it really as like a personal assistant in a way.
Yeah, and for me, kind of on that same frame, like I always think about it of where do I launch the action from? Like if it's not truly part of my workflow, I have to go and launch it from somewhere else. Like it might be really helpful to have the data coming back into the EMHware record, but a lot of when I'm looking at, even outside of EMHware, I'm looking at like Zendesk or different functionalities for and working with the various people at EMHware, it's very much like, is this in your main system of record where you're launching this from? Are you kicking it off from your browser, which is where you're accessing EMHware? So those are some of the things when I think about like true integration. So it's not just a layered on, and I also have to do this. It's very much how do we make sure that it is easily accessible and you're kind of being prompted or you're utilizing it from where you're doing the rest of your work. And I think that's really important. And you might not always have that at the MVP stage of products, but when you start to get to that general availability or kind of the 2.0 versions, it really should be integrated as much as it can into a workflow. Um, Jumping a little bit into we talk about the summarizer a lot. And I did kind of mention this earlier that we were taught right now it's limited to case notes and the unstructured com and text in there, where it's essentially a straight document, a Word doc is a case note in our system. Um, we are looking at ways to expand it. We're just looking at where is it going to be the most impactful to be able to capture that unstructured information to be able to summarize things like case notes, um, PDFs, like those are kind of down the road, version two, version three, um, ways for us to augment the summarization tool as we get more feedback from the folks using it. Our goal is to never put such a complex feature out there that it makes it really hard to actually update based on feedback. We want to get the feedback and then iterate based on the feedback rather than trying to get to the most perfect solution and then we realize it's completely wrong and is not helping anyone.
And I,
So,
I think the part about the MVP, the beta, and the general availability is another good way to look at it or describe it, where like, we'll start off small, make sure that the users are getting a lot benefits, say for a specific domain or use case. In this situation, it could be the case notes. And if there's a lot of success based on the feedback, we start expanding it across the other parts of the platform as well. Sorry for interrupting you, Sam.
no. You're the expert on this stuff always. So jump in as you can. Um, I'm have the chat up on one side with all the questions. Uh, as we look at technology is very complex. AI is very complex and a little like nebulous. We talked about it a lot, but we don't actually know like the nuts and bolts of a lot of it. Um, well, you do obviously, but like the broad majority of folks, like they hear about it, they hear about ChatGPT. Maybe their kids threw an assignment in and they got an assignment written for them in an essay in 5 minutes. Like that's the extent is the actual interaction with it. How, what are ways that folks can make this really transparent to both the workers and counselors and their clients so that they understand um, how it actually spits out what it spits out and that they can feel comfortable actually trusting that those tools are being used in their care journey.
Um, yeah, I mean, I think that will really boil down like once we get into the details. There's actually a lot of questions somewhat related to this. I was trying to look at one of them as well, is that when we start looking at the different models that are available, that we intend to use, part of it is really assessing like how good it's going to be, in terms of say translating the data into the format that we want or the output that we want. And so it could be making sure that we're using a more general purpose model that can handle the questions better, like a Q&A better, or do we look at focusing on models that have been trained specifically, for example, medical cases, which will output something different, but much more targeted into a specific domain or area. So that's
Mm.
one way to look at it. And again, as we're looking to implement it, the intention is to actually review the performance of these models. There's going to be a bunch of different tools as well that we're going to implement as part of the AI pipeline, I would say, to actually help us test this going forward.
Yeah, that's super helpful. And I do find really making it clear, especially to the clients, like this is not replacing clinical judgment, like full stop. I don't think that there are any tools, and I don't think any vendor would say, I want to replace the clinician. Like it's you need to have that additional view of like, yes, it's going to help me and it's going to hopefully reduce some of the burden, but ultimately the clinician will make the judgment. The same with every assessment that there is right now. If you're filling out a chime or if you have different larger assessments, you might realize as a clinician looking through, like, it doesn't quite jive with what I was expecting. And that's going to be the same with AI and AI outputs. It's very much here is what what it thinks is right based on the information it has. And then it's always going to be the clinician that will still have to sign off on it. It's like, yes, this is what I agree with, or yes, this is what I also wrote down, or whatever it is. And there's the ability to edit that before it gets committed to the record. I think that's really important as the training happens for these AI features. And as some folks might know, maybe not everybody, whenever there is an add-on module, there is training that can be done either virtually where it's just self-serve and self-learn through our knowledge hub, or one of our support or implementation reps will jump on with your team and show you how to do it. And you can ask questions to make sure it works with your workflow. And that's going to be the same model that we use for the AI add-ons that come. Um, when we talk about cost of these, That is done from bottoms up. So we look at how much is it going to cost based on the anticipated utilization for us to be able to pay the model or whatever different tools we need to be able to do it and service it and make sure we have the ability to keep investing in it. So there will be a cost. At least in the next 2 to 3 years, there will be a cost. In the future, we always look based on client feedback. What are the opportunities to roll additional functionality into the base platform? So folks that have been with us for a while, like two-factor authentication at one point in time, many years ago, that was a paid add-on. It is part of the base package. The same with the client portal, that is part of the base package, and text reminders also part of the base package, and those were all add-ons. So it is something we look at every year. What are the opportunities for us to provide more value and still allow people to turn it on or turn it off? It'll just be an included part that when you're ready and comfortable, you have the ability to turn it on without having to do another contract and be like, oh, I need to find the money for it.
And can I add one thing, Sam? Because looking through the Q&A, there's a lot of related questions around the privacy and awareness and transparency of the feature. And I think you've touched on some of those points. EMH has always been configuration driven. So, we will be providing the choice of when, if you want to use it. It can be the plan is to be able to turn it on and off. And if we put it in the different parts of the application, one thing that we will always factor in is having full notice that when we're activating that feature, there'll be some form of consent to before it gets turned on at the time. Those are just some of the strategies or things that we can do to make sure that the users are aware that it is being used. So many different ways to tackle it.
Okay, I am scrolling through because there's still lots of questions in here. And I'm actually going to jump on the privacy and security. We are more than happy. Like as we get questions from people, we keep going, okay, is this going to be something we're going to get again in the future? If so, let's make document that we can post about it. And I think the privacy and security component, especially with relation to AI, will be something there will be customer-facing documentation for, that you'll be able to keep in your records as well, and it'll be within our knowledge base. Um, Transparency for us is incredibly important. I know folks that have been on calls with me or with other folks on the team, we're here to just tell you. It's better if everybody has all the information rather than a massaged version of what's going on. So there will definitely be the opportunities to be able to provide that documentation. When it comes to the beta testing, there's lots of questions on beta testing, which makes my heart sing. Or if you want to roll it out at your organization. When we look at a lot of our functionality that we have, it's very granular in how you can roll things out. So just because you're getting a prescription writing module doesn't mean everybody gets the prescription writing module. You can have it specified to specific rules. That is how we look to roll things out so that people aren't getting overwhelmed by having access to everything if it's irrelevant to them. So that also supports in some of the beta testing where you're like, you know what, I want to use it in our production environment because we are going to roll it out, but I want 5 people to kind of just make sure it's going to work with their workflow and our specific setup. That's totally cool. We will have the ability where you can turn it on and off. And that is a difference that you might have in some of the buying tools that are outside of the EMHware ecosystem, where you have a little bit less flexibility in that and a little bit less control. When it comes to being able to demo and be like, I just want to see how it works, we will be providing access within our demo site, which all agencies can access. If you don't have access, you can create a support ticket at support@emhware.ca, and they'll be able to give you access for your agency into that demo environment. And so that goes, you can see every single module, you get access to a whole bunch of things, and you can just make sure that you can play around with it prior to making a decision on that front. Um, on the feedback, this is something that is super important. Without feedback, we can't iterate on products. So through this process, those specific defined beta groups and the MVP groups, they will have someone that's actively meeting and following up with them. So it doesn't, when we look at our kind of process that we have in place, things aren't going to be what we call generally available or available for anybody to sign up for until we've had some of those interviews, we've checked the workflows, we've gotten any of those little blind spots that we're like, oh, we should look at that. A good example is working with the child and youth organizations before we rolled it out to any child and youth organizations for the direct and indirect hour changes. We went through and we did a fully separate testing process with that sector while everybody else already had access to it to make sure that all the specific reportings and counts and data submissions were still going to be accurate with those changes in the platform. So lots of flexibility with how we build it, how we turn it on for some orgs and not others, some users, not others. It's very much we work with you on that front and we build everything with that configurable mindset to give people ultimate control. Mark, have you seen any? I'm going to pull a question here. Have you seen any tools, especially on and we'll limit this one to Scribe, um, and you might not have an answer for this as well, which is also could be something we should add to our checklist. Um, have you found scribes that are able to manage group sessions? So with multiple people in the room and still being able to identify speaker one, speaker two, speaker three, speaker four, potentially.
Um, I'll have to say you're right. I probably am not, I'm not sure. It's probably something that we'll probably just have to put on our checklist. I know that a lot of the different scribe models usually tend to, um, uh, the word escapes me, uh, tunes out a lot of the background noises. So I think like me, from my opinion, I think it would have to depend on the different model and how they've been trained or tuned to handle that type of conversation. So it's certainly it's a good question to ask. I was looking at in the Q&A. And I think when it comes to making an assessment on the which tooling or which vendor that we tend to integrate with, it's something that we should certainly be looking into and factoring in as well.
Yeah, that's I'm thinking through some of like the note-taking tools I have, and they definitely can pick up multiple speakers. They might not always be able to say this speaker is this person, which I think can also be kind of a step two of that of how do you do attribution of Mark spoke versus Sam spoke. I just have to remember that Mark was speaker number one.
Or even just identifying that it's a different speaker altogether.
Yeah.
So
Yeah, I was looking through summaries yesterday and I was like, oh, I can do. It was picking that up or was not picking that up. Um, there's an interesting question. Um, are we, and I'll kind of jump in the first part of it. Are we going to only stick with Ontario Health approved vendors for the solutions? And I'm going to jump in there first. With the way that those vendor of record processes happen, it all comes down to scoring. So you might actually miss some of the top vendors when you just use the Ontario Health approved ones. We definitely look at who's been approved by both EMHware and Ontario Health and outside of the province, depending what part of the platforms we're looking at. But that won't be the defining measure of our decision. It will still have to meet some of those criteria we set up front. So the criteria up front, that's really our guiding post on how we look at if we're going to partner with somebody on a specific component of our AI functionality. But we wouldn't limit ourselves to say, okay, we can only partner with X vendor, Tally Plus at TELUS Health, for example, for a scribe. There might be things like, oh, we want to partner with this specific vendor on the back end model, and then we're going to build this part of it. So you end up with a bit of a hybrid where it isn't necessarily saying, okay, we're picking one full company solution and another full company solution. It ends up being a bit more complex than that, but it's definitely a great starting point because we know what they look at when they're measuring if somebody can get a vendor of record status. Another great question on our UI, modernized UI. So that is for the folks, I think almost everybody has it now. When they log in and the schedule view is nice and clean and it's the white treatment, a little bit less cluttered and there's some additional functionality, we are gradually building out every screen in the platform like that. So you'll keep seeing though a new screen pops up and we will roll that out. We'll test it with one small group, following that beta and general availability structure. Um, but we will always be looking at how do we integrate these tools. With that new framework, it makes it significantly easier to integrate tools and make sure that we can build those into the actual workflow.
And you, that's a good question to ask. I mean, with in terms of modernization, our approach, if I was to repeat it, is we're very MV like walk, crawl, run type of approach. So as with the modernization, we obviously are very cautious about impacting large users, and change management is really important to us. So, we do things like provide the ability for you to toggle between old and new as a capability to ensure that if there is something that you either don't see or something that you want to provide feedback on, we don't disrupt your workflow and allow you to kind of go back to the old experience until we fully flush everything out. So that's the same approach that we have with a lot of our features. Um, and the second part around uh, the part about the Ontario Health question, I mean, I think you answered that great, Sam. And one thing I did want to add is this hasn't really changed for us. I mean, when we assess vendors or even the tooling, we always look at how we can keep this in Canada, right? Like there's a lot of sensitivity around making sure the data is within Canada. That's never changed. And when we build out a lot of these features, we have a few different options. When we discuss or assess tools with the vendors, that's probably one of the top questions we have. Where is the data stored? Where are you hosting the model? And one thing that I didn't kind of mention is we intend to use a couple of different approaches. We actually have the capability or will be looking into hosting it internally within EMA. So being on the cloud in AWS and using the Canadian data centers, we can host a lot of these things within our own infrastructure as well, meaning the control is with us and in turn with you as well.
It's good additional context for sure. Um, there's one quick question around talk to text. So it is an existing EMHware function. Um, are there going to be additional enhancements? And for those that don't know, our talk to text uses the in-browser talk to text functionality, and then it will populate into the actual case node. So it would be kind of a light version of a scribe, but no formatting, summarization, or additional changes. It would literally be I am talking, and it's going to be a big text block. So that is something that you can ask to have turned on. You just want to triple check some of your internal policies around if using like the Google Chrome dictation functionality is in alignment with that. Some organizations might have different policies than others. If you want it on, you can always reach out to support and they can turn it on for you. And it might be one of our self-serve configurations that is going to be available very shortly.
And uh, And I think right now, Sam, I think that's only with a subset of our users. I think this is one of our kind of walk, crawl, run. And to answer further on the question is yes, we do plan on expanding that. The initial MVP, I would say, is just a way for us to, excuse me, roll it out to a smaller subset. But as we kind of build out a lot of these AI features, that's probably going to get supplanted by a much more sophisticated feature with the scribe initiative that we have that we called out in the roadmap. So
For sure. I'm going to answer one last question, and then we are going to wrap it up. I know there's still a few in there. So we'll go through, and if the ones that we don't get a chance to, we will follow up via email. Um, the scribes tend to not be the scribes tend to be used if you're even if you're in a telehealth or just doing in person, as long as you have your laptop with you. or whatever device you're using. It is quite broad in how they can pick up the voice for that. When it comes to if you have to submit documents to court and you're subpoenaed, or how long we hold on to data, it gets treated like regular data because your team still signs off on it. So it might be AI generated, but your team would then go through, they would review the case notes, or if it ends up being in a case data, if we get to that point, they would then be signing off on it as if it is their work. And that is pretty common across both in medical right now, where they would still sign off and you're like, am confirming that this is accurate. And then along with our changes, we do have our release notes. There are picture walkthroughs, and we usually do looms as well. And we put those updated loops in Zendesk. So Mark, thanks for joining me. Thanks everyone for coming on. We had over 120 folks that joined us. And thanks for the people that stuck on the extra minute. Adele's going to be following up with a email, so expect to see that. There's going to be a few links in there to either book some demos, start to look at those things, and just keep an eye on it. We hope to see everybody at our next webinar in a few weeks, and you'll see emails coming out for that shortly. Have a great week, everyone.
Have a great day, everybody.